Hi, I'm Dr. Lisa Port. I'm the Chief of Breast Surgery at the Mount Sinai Health System and the Director of the Dubin Breast Center.
Hi, I'm Dr. Lori Margulies. I'm Assistant Chief of Breast Imaging at the Mount Sinai Health System.
Mammogram May is really a way of raising awareness. And no surprise, Mother's Day also falls in May. And so it's really a way of raising awareness regarding the importance of mammograms and how mammograms do save lives by picking up cancers earlier, and that all of us should make sure that we're on track to getting our mammograms as recommended.
So average risk women should start getting mammograms at age 40 and continue to get a mammogram every year thereafter. So once a year, every year. And it's good to kind of pick a month that you can remember. If it's an anniversary or a birthday or some special event or a holiday, always pick that month and go every single year, beginning age 40.
Yeah, it's a really good question. And I think that it has to really be decided on a case-by-case basis. As Dr. Margulies said, the recommendations for average risk women is to start at age 40, but we do sometimes start women earlier based on increased risk. So for example, we typically say women should consider starting to get their first mammogram 10 years younger than when their youngest relative was diagnosed. So if my mother was diagnosed with breast cancer at age 45, I might be starting at around 35. And of course, there's other situations that are genetic predisposition conditions that put women at very high risk for getting breast cancer at young ages, where we might start even earlier. It's really decided on a case-by-case basis with a woman or a young woman and her doctor.
So the mammography van brings our state-of-the-art 3D mammography to the patients. It's exactly the same equipment that you'll find in the majority of the Mount Sinai Health System mammography facilities, but it comes on a bus. So it might come to your religious organization, it might come to your doctor's office, it might come to your community center or a politician's office, and allows you to get the screening somewhere where you feel comfortable. So if for whatever reason you are unable or feel uncomfortable coming to one of Mount Sinai's fixed sites, you can easily get your mammogram on the mobile van. And what's great about the mobile van is not only is it convenient, but you often don't need an appointment and you don't need a prescription. You can self-refer and come to the van. So if you see it on your street or in your neighborhood or know that it's coming, please come and get your screening mammogram.
Sure. Well, of course, we all know that COVID and the pandemic contributed to a significant number of women delaying all kinds of, and men, all kinds of checkups and healthcare interventions. People were afraid to come into the hospital for fear of exposure. Many centers were shut down temporarily. Many people moved away. In New York, a lot of people left the city and didn't really have access to the places where they normally went. So it is very important to get back on track. All of those dangers and concerns and limitations have really been gone for quite some time now, and we have been back to business as usual at Mount Sinai for since May, right after the first surge of the pandemic. So as we say, don't put your health care on hold, and that applies to not only mammograms, but so many other health maintenance kind of appointments and screening exams that are important.
So the vast majority of mammograms in the Mount Sinai Health System are what we call 3D mammograms. So that allows us to not look at just one picture of your breast, but actually look at little slices of information throughout your breast, which helps in decreasing the recall rate. So less people have to come back because we can see the tissue earlier. And if you have denser tissue where it might hide a small cancer, we can find that cancer perhaps because we can see it on these little slices and have it not mass. However, we know that mammography is not perfect, and it's not all that some women need. So women with dense breasts can also get screening ultrasounds at the Mount Sinai Health System. And those at the highest risk of breast cancer can also get screening MRIs. So it is very important that a woman understand her breast density as well as her own personal risk.
Oh, we offer at all of our locations the most comprehensive, cutting edge care for breast cancer on all of our campuses. And as most people know, one of the reasons why the survival rate from breast cancer is so high now in 2022 is that there is no one size fits all for breast cancer. We treat not only based on the person, but also based on the specific type of breast cancer and the extent of disease. And so we offer each patient a very individualized, cutting edge approach to the care and treatment and cure ultimately of her cancer.
So you can learn about a mammogram very easily on Mount Sinai's website by just looking in a search engine for Mount Sinai Mammography or Mount Sinai Mobile Mammography, and you can find our multiple sites. You can also call us at 212-241-8333 and get to our scheduling department to find out where and when you can get a screening mammogram.